Let's start with Shane Foss. Welcome to the show. Thanks for being
Thank you,
here.
Michael. Excited to be here.
I'm glad you're here. All right, Shane, give us a little background on you, the man driving the boat, on what you're doing with your company, Hooray Health, and then let's drill right down into some of these questions, how your processes are so disruptive that you're just changing the healthcare industry when it comes to your industry sector of the healthcare industry, putting the whole thing on its ear.
Yeah, all right. I appreciate it. So my background is 26 years in healthcare and multiple levels, and different leadership, really focused on sales. And so I've got a broad experience of looking at it from different views. And so when we started Hooray, we really looked at solving some basic issues, which was really accessibility, the simplicity and the affordability of healthcare. I've been self-employed for a long time, and when my wife and I were talking about our latest insurance needs, we just really looked at the expense and is it really worth it, or is there something else we could do? So we created this basic health insurance plan for everyday needs, and so we're disrupting the market because we took out all of the kind of the fluff of health insurance that drives up the costs. And so we started with a mobile app, and so you have free access to your provider network, which we have a dedicated provider network that is of urgent cares and retail clinics, which they're the most, if you look at the opportunity to see a physician in a short amount of time, they're the best opportunity. They're all over the place. And so you really improve your access to healthcare with that.
Okay. Do you work with all spectrums, or do you focus on a certain size of businesses that you're working with Hooray Health?
So we focus on the individual.
Okay.
So you don't need to be employed or with an employer group to join Hooray. You can actually go to the website and 3 clicks, and you can have coverage within 24 hours. Our groups, we can actually work with small groups, 20 members or larger. Our sweet spot is really around 200 to 500 members, because that way you look at restaurants and that are trying to offer a basic plan to get the coverage for hourly employees.
Let's get into the key issues here between employers, employees, and when it comes to purchasing and the use of healthcare insurance. I want bring that out, and then how you're different from everybody else.
Sure. So really, there's an issue with accessibility, right? So when you're an employer, you give them the plan, and then what happens is you have a $5,000 deductible.
Right.
And so when you have that $5,000 deductible, you have to go in network. You go in network, and then you get a $75 copay, but you don't really know what's included in that contract, that PPO network. So you end up paying for services with a balanced bill, and so that's a big issue because 85% of Americans today have less than $3,000 in their savings account. And if you have $3,000 in your savings account, you can't afford that deductible. So as an employer, you're putting financial burden on your employees. So where we're different is we have a $99 option for the employee that covers their basic needs. And so if you look at an employer as well, is they don't have to take time off work during the day, or if you have odd hours, they can go to the urgent care, which has hours from 9 a.m. to 9 p.m.,
right,
which is more accommodating for them.
Shane, do you see this as an augmentation of existing plans? Because ultimately, back in the 70s, this is before any of you guys were born, healthcare was, you had an 80-20 plan where ultimately you had a plan where you covered your major medical and pretty much everything else you covered yourself for the most part with a 20% deductible, which usually maxed out at $4 to $5 grand, somewhere in that range. When you look at a plan like yours, do you see it as something that you add to an existing plan, maybe a major medical plan, in lieu of just having the giant plan where you end up having this unlimited amount? It seems like it would marry well with something like that.
Yes, it's a great supplement to a major medical plan. If with the $0 deductible and first dollar care. So if you have a high deductible, this is a great low-cost option to take care of your basic needs. And so then you can use your major medical for a catastrophic. But what we're seeing is that there's a lot of individuals out there that just don't have insurance and can't afford a major medical insurance. So what happens is they can buy Hooray just for their basic care. And 62% of personal bankruptcies are from medical-related bad debt, and 78% of them had health insurance. So it's a real issue. So this is an opportunity to at least take care of, if you don't have anything, you can use it, or if you have a high deductible, you can use it as a supplement. So that's a great question, Ed.
Yeah.
How when you look at something, it seems like this thing should spread like wildfire. Because if you think about it, I have 12-year-old, 18-year-old, 22-year-old, and I know I've been to some of those places you mentioned before. I walk in, I pay whatever it is paid, and I'm done with it. I don't understand why people aren't necessarily jumping on this like wildfire, thinking, here's a chance to take care of the things that you do on a day-to-day basis in lieu of the things you don't. Because if you think about it, you go to Parkland, you go and need a hospital around here, there's people sitting there waiting to see someone, and it's costing $3,500, $5,000. It's almost like a gas pump running when you look at the actual situation as far as the health is concerned. So do you see this as a response or an answer to that type of problem for the everyday healthcare need? Absolutely.
Yeah. Great example. My 14-year-old daughter is homesick right now. We took her to urgent care, and based on our contracts, we protect you against a balance bill, because in our contracts they accept our payment as full. So we pay a $25 copay, and you're set. You're protected. So it is a solution, because there's a lot of people that are going out there and they don't understand what's covered with that $25 copay, and then they get the balance bill, right? And that's you're not protected.
Well, I want to jump in there. Ed, you had mentioned, why isn't people jumping all over this? As a matter of fact, one of our major sponsors, we just found out today, which has well over 4.6 million clients of their own, just jumped all over this.
Right.
So it is taking off. We just happen to be, at the spearhead of bringing new technology, new disruptive processes to the, that's our hallmark, Ed.
Well, it's a solution that's found a problem for the most part, or a problem that's found a solution one way or the other. But obviously, people have to understand that everyday people need to have health care. Let's just keep it real. They really do. Right. And offering a product like this is something that gives them a chance to take care of that without it being catastrophic for their own budget.
Yep. Exactly. All right, we're going to run out of time here, but before we go, how do you get the app? How do we connect with you so that the rest of the world can know what we know and take advantage of what you're doing?
Absolutely. So today you can go to hooray.healthcare. Just type it right in your Google, and you'll go directly to the link, and you can look at our plans. In 3 clicks, you can have a policy tomorrow.
Now that's the way to put it together. All right, that's it. And the app is there on the.
The app is on the App Store for both Android and Apple. Hooray Health, and you can download it for free.
Perfect. All right. Thank you so much for being a guest on the show.
Really appreciate your time.
My pleasure. Shane Foss, founder, CEO, Hooray Health, HoorayHealthcare.com. This segment brought to you by TheVitaminPatch.com. We're going to go to a commercial. We'll be right back on the other side of this break with Ed Baxter and the Private Equity Spotlight. You've been listening to CEO Money.